Hey guys, welcome back. Dr. Dustin, board certified dermatologist, and today we're going to be looking at some skin tag removals, some pimple pops, lots of fun stuff, and educating a little bit on the way. If you're new to the channel, I've just turned on memberships. If you're a longtime watcher of the channel, memberships are on. Anything that you subscribe to through the paid membership program will help to support my work in the mobile clinic to provide free dermatology care to underserved populations. So thank you for your support of the channel. Let's jump into these videos, have some fun, and learn a little bit. All right, this person has a filiform mole, it looks like, on the neck. This is probably a mole, and they're using a plasma pen to remove it from the skin. Now, this would be painful, so hopefully the person has been numbed before this with a little lidocaine. And this is not my favorite way to remove moles. The advantage here is that the plasma pen does coagulate as you cut through the skin. It just takes a lot of passes to get there, but there's no bleeding. And that should be sent for biopsy in order to make sure that there's no cancer. We've got significant blackheads in the ear here, and they're coming in, thankfully, with gloves and good tools. They've got cotton-tipped applicators. And some people are just going to be prone to these blackheads in the ear. You can get a similar appearance with a type of lupus that appears on the skin. But they're going in, loosening them up, and then just kind of squeezing them out, plucking them out. This person's probably going to feel a lot better, even though these aren't normally painful, but just from a confidence perspective, getting all of these out of there. And this is an area, obviously, where you want to be careful if you're using skincare to try to prevent blackheads. You don't want to be getting that stuff down in your ear canal. There's a lot on this side. This one looks like it has multiple openings that are all connected to the same thing underneath the skin. And if you've ever had a pimple in your ear, you know that manipulating these, pushing on them, is tender right on top of the cartilage. The skin is so thin. Good camera work though. We're seeing everything we need to see. Got a lot out of there. That's pretty impressive. I like it. This person has what looks like a seborrheic keratosis on the cheek. This is a collection of skin cells that just didn't slough off properly. They are more common in elderly people and those with significant sun exposure, and they are not cancerous. Now, they're removing it with a plasma pen, which is kind of cutting through the skin with heat and electricity. This is not my preferred method to remove these. And what I would like to see as they start to get under it is for them to use some tweezers to lift up the edge so they can get a more clear look as they get more towards the middle of the lesion, and they're not doing that here. But this is going to remove the lesion, something that is not cancerous, does not have large potential to become cancer, and they're going to be pretty happy with the result overall. There's that seborrheic keratosis. All right, this person has a large skin tag on their body. It looks like it'd probably be big enough to be called a fibroepithelial polyp, which is just going to have a lot more fat inside of it. These are a nuisance if you have them. They're uncomfortable. They're not real risky to you, however. They don't turn into cancer, but most people do prefer to have them removed. So you can kind of see that yellowish fatty tissue on the inside as they get through it with the plasma pen. Again, that coagulates so they're not going to bleed, and that should be sent in for biopsy. Get ready for this one, because this guy is mashing on a huge pimple on his cheek, and I just got to ask, why does this look like Chris Tomasian with acne? He's going in with the knuckles. He's really getting some leverage on there. Ooh! Plastered the mirror with that one. This person is by the nose. They've got some whiteheads, some blackheads, and some inflammatory acne coming in with gloves and a comedone extractor to get this stuff out of there. And they're popping out nice and easy. This is going to go better if they had a little chemical peel beforehand to loosen up the top of the skin, something with like glycolic acid and salicylic acid. The tool in and of itself is a little tender. It's just a small little piece of metal, and it can be painful to do this. But they're getting a ton out. You get this person on a good skincare routine and try to prevent these from coming back. Just got to wipe all of that off the skin. But you can see the impression that it's leaving. This person has a lot of edema in the skin from the inflammation. If you press real hard in an area, you can break little blood vessels. You can bruise people in doing this, so you have to be careful. In the bathroom, you know it's going to be a bad place to pop a pimple or a cyst. This guy's leaning over the bathtub. They just sprayed all over the window. No gloves. Look at that thing shooting everywhere. Somebody's got to clean that up. They've got a towel on his back, but it's not helping the window. Unbelievable. I don't know who's popping pimples without gloves, but we got dirty fingernails on an earlobe. Kind of mashing that out of there. I have seen this happen in neglected piercings. We've done some of those on the channel as well. It's fun though. I just wish they had gloves. Got the soft music in the background. You gotta really like somebody to get their oil gland juice all over your fingers. Right, this person has a lot of like closed comedones, and then there's a little darker blackhead up above the eye. So they're zooming in close to get a closer look. There's no gloves here. And we got a great view of the eyeball there. Healthy looking eyeball. So they're coming in with a sharp tip. Making a little opening on the skin, and then let's see what they get out. They tolerated that really well because they haven't been numbed. And here we go. Here we go. Look at how black it is. That is super oxidized oil. Ooh. You know it doesn't smell good. All over the finger. It's like a little spring coiled up there. Ooh, where are your gloves? Where are your gloves? I do not approve. This is a pretty large cyst on the shoulder. They're in a clinic. We got gloves, and they're just going right for it, mashing on it. These are commonly called a sebaceous cyst, but it's really an epithelial cyst. An oil gland gets plugged up. It keeps producing oil, keratin, and now we're popping. Now we're popping. I like it. Gotta see. Oh, that looks painful. We've got an infected cyst here. It's like half coming out already. I don't know if they've already been mashing on this. Yikes. They're giving him a hard time. Like, how did this happen? Oh. This is a pilar cyst, most likely. If it occurs on the scalp, they just look a little different under the microscope. You gotta like this person because you just got all of that stuff all over your fingers. No gloves, in the bathroom again. No thank you. Rounding us out here. Got a little tiny cyst, little abscess, little infection. Using the cotton-tipped applicators just to get a little pinpoint pressure, and boom. Popped it right open. There we go. Guys, thank you so much for watching this video. Remember, when you like, comment, subscribe, and share this video with somebody you think might enjoy it, it helps to support my work in my mobile clinic to provide free dermatology care to underserved populations. So thank you for your help on that. I will be back next week with another full-length video reacting to some of the best stuff that I find on TikTok and Instagram. So until next time, I'll see ya.